I'm going to talk to you about the different types of shoulder injuries we see. I'm not going to go over everything, but I want to let you know the most common injuries that we see and how you can approach those and how you might know which category you fall into. So the most common shoulder issue that we see in general is impingement syndrome. That's basically inflammation around the rotator cuff. Sometimes it happens for no good reason, just sort of comes on its own. Sometimes it happens after some activity. So for example, painting the ceiling, moving some suitcases. And what impingement syndrome is when your rotator cuff actually pinches against the bone above it called the acromion. Causes pain that oftentimes comes down the arm and particularly bothers you when your arm is outstretched or going overhead. So that's impingement syndrome. Impingement syndrome, you can normally give it some time, avoid activities that hurt, and hopefully it gets better on its own. If it doesn't get better on its own, you can always come and see us. Another common shoulder problem are rotator cuff issues. And rotator cuff issues really come in different varieties. Some rotator cuff issues happen slowly over a period of months, even years, and gradually get to the point where you can't sleep at night and you're having a lot of shoulder pain. Other rotator cuff issues come from a fall or an acute injury. So, for example, if you have a fall and you land on your arm and now you have pain on the outside of your shoulder that comes down the arm and you can no longer lift your arm up, you very well might have a acute, meaning a fresh, full thickness rotator cuff tear. That type of injury requires attention and needs a diagnosis fairly soon to determine if treatment is warranted. So if you're in that scenario, you should reach out to an orthopedic surgeon via telehealth or personally. If you're in the other scenario where you've had some shoulder pain creeping up for a few weeks, even if it's from the rotator cuff, you can in general keep an eye on it, modify your activities, and see how it goes. And then after a few weeks or months, if it's not better, contact an orthopedic surgeon. Another type of acute shoulder injury is a dislocation. This oftentimes happens from a fall, or if you're playing basketball and your arm gets brought back, you can dislocate the shoulder, the ball of the shoulder, right out the front of the socket. That's the type of injury that oftentimes requires a visit to an emergency room to have it put back into place. Once in a while, it can come out of place and come back into place on its own. That's the type of injury that usually requires care sooner rather than later. Oftentimes doesn't need a surgery, but an orthopedic surgeon should see it. Usually an MRI would be ordered and the diagnosis would be made to help determine exactly what's going on. So is it just the tear in the cartilage bumper in the front, the labrum, or is there a piece of bone that's knocked off with it? Those are things that are better determined sooner rather than later. Another type of shoulder issue that we often see is what's called a frozen shoulder. You may have heard of this. The technical name for it is an adhesive capsulitis. And what that is the capsule around the shoulder. So all joints have a capsule that holds the fluid in and around the joint. So in the shoulder, for example, there's a ball and a socket, and then the capsule keeps the joint fluid from going anywhere. And that capsule can become very aggravated, and when it does, it shrinks down and blocks the motion in the shoulder. The hallmark for this condition is that you lose the ability to get the arm behind your back. It oftentimes happens in ladies in their 40s or 50s. There's also an association with thyroid disease and diabetes, but oftentimes it happens for no good reason at all. It's a very painful condition that can interrupt sleep cycles. And if you have this condition, you should contact an orthopedic surgeon sooner rather than later. And you can do that via telehealth or an actual in-person visit. But oftentimes dealing with this problem early leads to a better outcome and a quicker recovery.